Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, thanks for hanging in there with us. We're going to have an abbreviated show for the next, about 15 minutes. We're talking about a very important topic. So many people suffer from headaches. We have one of the top doctors in the Texas area, actually in Austin, Dr. Stephen Clayman. Good morning, Dr. Clayman.
Good morning, Steve. How are you?
Good. We're talking about headaches today, and we actually started talking about headaches last week, and we got barraged with calls asking us if we were going to do more on headaches, and voila, here we are. We don't have a lot of time, but what is the different types of headaches out there?
Yeah, let's get right into it. Everybody experiences headaches at some time in their life. Some of them become chronic, meaning they have them every week or sometimes several times a week or even daily. The main type of headache, the most common type of headache is called a tension headache. And we're going to deal with how you can fix that yourself today on today's show. We're going to show you a technique that will most likely get rid of your headache. And then there's some treatments that you could do on your own. Sometimes you have to go into the doctor's office or the chiropractor's office. But the most common is tension headaches. After that comes migraine headaches. Those are the two most common. And then you have a very small percentage of people who suffer from cluster headaches, which is a type of headache that we don't really have a solution for. Fortunately, it doesn't occur to very many people, and some people will never experience it in their lifetime. And then the other type of headache is a sinus headache, which is usually due to an allergy. So, and it just happens that in Austin, which is known as the allergy capital of the world, we treat a lot of allergies here at our clinic with a fantastic technique. And of course, now we're just entering cedar season when the juniper bush flowers and people get cedar fever. And we see a lot of that in our office. About a third of my clinic is allergies. But let's talk about the tension headache and how people could fix it themselves. Is that a good place to start?
Is that the most common type headache, Dr. Clayman?
Tension headache is the most common type headache, yes. Sometimes it's so bad, people think it's a migraine. And migraines are typically can be characterized by nausea, vomiting, seeing auras around objects. If you have a bad headache and you're not seeing any auras and you're not vomiting, you're not nauseous, it's probably just a bad tension headache. So I learned many years ago an acupuncture technique or an acupressure technique that works almost all the time. And I think that's the most important part of today's show. So I'd like to explain it so people can do it themselves.
Please.
So if people have pen and paper and they can write or they can record this, they'll want to remember these 8 consecutive points on the body that you can poke with either a pen, a fork, any blunt object. I, in my clinic, use what we call a teishin, which is a non-piercing acupuncture needle, but it's not the needle itself that makes it effective. It's the point. It's the placement of the point. So let's go over it. The first 2 points, and this will take away the headache usually within a minute. It's quite spectacular. So the first 2 points are on the hand, where the thumb and the index finger meet. You know, there's that crack there.
Yes.
Right there. If you take your little tool like a pen or a fork or the end of a spoon and poke into that point for 8 to 10 seconds. And you do that on both hands. You can start with either hand. Just poke those points for 8 to 10 seconds. Then you move up. Those are points number 1 and 2. Move up to points 3 and 4, which are at the base of the skull in a depression about 1 or 2 inches off the midline of your skull. So if you come to the midline and go off to the side, you'll feel 2 little depressions in there. Can you feel that, Steve?
Yes.
Yes. So those points are 3 and 4. So you take your pen and you tap in there also firmly for 8 to 10 seconds on each of those points. Simple, right?
Yeah.
Then you come up from the tops of your ears, come right to the midline, right on the crown of your head, and there's another point right there, right in the midline. You tap it for 8 to 10 seconds. That's point number 5. Point number 6 is right here between the eyebrows. These are all acupuncture points. So point number 6 is right here. You just tap it. 7 is at the hairline, or in our case, where the hairline was, you tap that point right there. So that's point number 7, right there on the top of the forehead. And point number 8 is in the midline, right at the base of your skull, right between your skull and your neck. You tap that point. There's also a little depression at the base of your skull. You tap that point, 8 to 10 seconds. Then you stop and you see how you feel. Oftentimes,
You do all 8 of them?
You do all 8 of them, and in that order.
Okay.
Yes. If the headache's gone, you're done. If it's not gone, and it should be gone within 10 or 20 seconds of doing this. If it's not, and then you say, well, I still have a little headache over here. We do what we call circle the dragon point. So you take your tool, your pen, your fork, and you just circle around that painful area. Let's say it's on over here, or if it's on top over here, circle around it, and you do it on both sides. So you would hit here, and then you hit over here.
Can you use your finger?
You can use your finger too. Exactly.
Okay.
Exactly. And I've been using this technique for decades. It was taught to me by my acupuncture professor, and it works almost all the time. Now, that's to get rid of the headache for now. What you'll find in almost everybody who has headaches is you'll have trigger points or pressure points along the base of the skull that are tender. If you put your thumb in at the base of the skull and press firmly, you get headaches, you'll feel some tender spots. There's about 5 of them from the under the ear at the base of the skull right to the midline. And you have them on both sides. To get rid of the headaches long term, every day, press on those trigger points. It's lactic acid that's in the muscle. You press on those, don't wiggle it, just press really firm and hold it there for 5 to 8 seconds. And you go along the skull. Any of those that are tender, you press on those.
How do you know the difference between a tension headache and a migraine, say?
Well, again, migraines you'll tend to have nausea, vomiting. You'll see auras. When people come into my office with headaches, I frequently ask them, do you get neck pain? And they frequently do get neck pain. And the neck pain is frequently associated with the headache. So to understand what a tension headache is, you have to understand that sometimes the vertebrae in the neck get misplaced. They press on nerves, which cause the muscles at the base of the skull to go into spasm. When those muscles on the base of the skull spasm, they pull on the cranial vault. They pull on the cranial bones. When those cranial bones get pulled on, it can change their shape slightly. They move. And that movement causes pain fibers inside the skull to get triggered. And that's called a headache. That's what a tension headache is.
Amazing.
Now, people will naturally find that they press on some of these points and it relieves the headache. Well, what you need to do is daily press on those points, 8 or 10 of them across the base of the skull when you find them, and press that lactic acid out. And you got to do it for at least a couple of weeks, and you'll get that lactic acid out. And then maybe once or twice a week, just press on them, just so the headaches don't come back. But it's a very effective way, and it's easy, and it's cheap. All you need is a pen.
Yeah. What about people who get headaches every day?
Yeah, so sometimes people, when they come into
Is that
my office,
abnormal?
sure, it's abnormal. It's way abnormal. You shouldn't be getting headaches at all. If you get a headache because you have a sinus condition, that's one thing. And if you fix the allergy, or you're doing some of these over-the-counter drugs that clears up your sinuses, the headache should go away. But if you're having headaches several days a week or every day, something is not right, and your quality of your life is being deteriorated. So you got to get rid of them, and they're not that hard to get rid of. It's not a matter of taking a drug and covering it up. This is a solution, and we've done it with lots of people, and a lot of people don't have headaches anymore.
That is amazing. Now,
Yes,
you said about the neck pain. What's the relationship with neck pain and headaches?
Frequently, people will notice that they get neck pain, and they may get headaches in relationship to their neck pain. So if the vertebra is out of place, pinching on a nerve, it'll cause the muscles to spasm, pulls on the cranial vault, triggers these nerve fibers in your head, and you get a headache. So in those cases, if I see them in my office, we'll adjust the vertebrae, get the pressure off the nerve, allow the muscle to relax, get the lactic acid out of the muscle, and that's the end of the headache. I had a psychiatrist come into me a couple of years ago, and she said to me, Monday, my husband came into you, and you fixed his sciatic pain. Wednesday, when he came back, you treated him for his lactose intolerance. And he went home and had milk and didn't have a reaction. She said, I get migraine headaches. I want you to fix them. So during the consultation, I just sat down and I did those 8 consecutive points. And I said to her, how's your headache? And she looked at me bewildered and she said, it's gone. That's how fast that works. So maybe for your viewers, we'll review the 8 consecutive points, Steve.
Yes, actually, they can go back to iHeart, Ask the Expert, Chiropractic Care, and they can listen to today's show, or you can go to YouTube. But those will always be in the library under headaches.
Okay, great. Excellent.
Tell people how they can contact your office.
Yes, if you've got a problem with headaches, you want me to deal with them. I'm in South Austin, near Dripping Springs, 512-301-7746. Just make an appointment. We'll come in, we'll see you, and we'll figure out why you're having headaches, and we'll see if we can't fix it.
Dr. Kleeman, thank you so much. God, your shows have always been so informative. We learned so much. Thank you so much. Have a wonderful holiday, Dr. Kleeman.
You too, Steve. Thank you.
Thank you. And that'll be it for us today. Boy, if you've got headaches, Dr. Kleeman in Austin, Texas. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.